I'm Rick Buck and I've been a dentist for 16 years. Today I have the most ironic story about how we fix the dental cosmetics of this patient. So let's get started with the procedure and I will tell you the story in just a bit. This patient is a musical performer and was unhappy with his front teeth. The previous dental work he had done was noticeable and it made things a little unsightly. And in addition to that, they also looked crowded and somewhat discolored. Now, by the end of this video, I will show you completely how we quickly transformed his smile in a little over an hour. So after he's numb, we start by drilling out the old bonding on his teeth. The patient wanted as little drilling on his teeth as possible, so I should tell you he only wanted this tooth and the lateral incisor next to it done. He didn't want me, at least at this point, to work on the other central incisor, which I tried to convince him to do. He thought that central incisor looked fine for now. He knew it wasn't perfect. Now this is interesting because the shade of the tooth he didn't want me to work on was not that discolored as you can see here, but that is only by comparison because the other ones are more discolored. The one I'm working on now is so far off in color he didn't think that other one was off that much. You will see once we fix these original two teeth that he wanted worked on that the other tooth will look way off afterwards. Now I should probably explain what we're doing here. I'm drilling quite a bit of tooth away on this right central incisor. This is because not only do I need to put a thickness of filling there so I can change the color without the yellow shining through my filling, but I need to remove even more than that because this tooth was protruding and we want this tooth to look like it's more in line with the other teeth. Now, since I'm going to do both teeth at different times, I'm going to tell you what I am going to do before I actually do it. So it won't be in sync with what you see on the screen, but let me just explain all the steps and then you can watch me do them. Once we have removed enough tooth structure, we're going to put a small plastic barrier between the teeth and put an acid etchant all over the surface of the tooth that will increase the strength of the future bonding of the filling. This leads me to the next step, which is scrubbing the bond into place with, from what I have tested, is the strongest bond that I know of. Now, these cosmetic bondings need all the strength they can get, so I have to use a strong bonding and I have to really scrub it in place, which also has been shown to strengthen the bonding. And these bondings have to have so much strength in the bond because they don't have any other natural retention. They are solely pegged onto the tooth and rely almost completely on the bond. So after the bond is scrubbed into place, it is set with a light cure, and then after we set it with the light cure, we start putting white composite resin onto the bonding and we add the resin composite in layers. And after every time we add a layer, we light cure it and then we set that into place and then add another layer, which we then harden into place as well. Eventually it will look like we added too much resin, and that's okay. We want that because after we remove the excess and shape it down into place with these discs that are kind of, well, they're sanding discs. After we've trimmed it back with those, it will look like a cosmetic healthy tooth. We eventually do this on both teeth. So now while I'm showing to you all of those steps that I just explained, here's the story of this patient. You see, last year I was watching my favorite TV show, which I admit is a reality show. And lo and behold, my patient was the one on the screen. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Most dental products have not progressed in the last 10 to 15 years, and these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best posted at the end of this video so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. Now, he was only recently a new patient at my practice and the issue was his teeth. As you saw, he had some bondings that were off, which was very noticeable on camera. Well, he was eventually eliminated from the show, and I called him up to see if he wanted to fix his teeth before the finale. He obviously did want to do that, but by the time he was able to come in, we didn't have much time to do it. And the only cosmetic option we could do was these resin bondings, or called composite veneers sometimes. And that was it if we wanted to produce a cosmetic smile in time for the finale. And so that is how he ended up here today. My patient was on a reality show. Okay, so now we are almost done with those 2 teeth, and I stopped to show the patient before finishing. And when he loves them, I know the very next thing he's gonna say. He says, actually, can you do the other tooth that we were thinking about before? And of course I wanted it to happen, and we were able to do it at the end of the day. But now that we know that, isn't it so interesting how much that tooth that we didn't think stood out that much now stands out a lot more with the other 2 teeth looking really cosmetic. So now as we start on that tooth, you will see that we follow all the exact same steps that we just did on the other 2 teeth. So while we're doing them, I should probably explain to you a few other things about cosmetic bondings, or what we call composite veneers as well. Hands down, there are more cosmetic treatments for this case. Cosmetic crowns or veneers on the front 6 teeth would have been ideal, and I could have got this thing looking awesome if I was able to do those. The issue with these bonding is that they chip more frequently and can get staining around them. So while they may look nice at first, they do fade a little bit over time. Typically, they only last a few years before needing to be replaced or repaired. And this is especially true when that resin composite goes right up to the biting edge of the tooth. They just chip much more easily there. However, that being said, I've seen these last for over 10 years. So they are a bit of a gamble as to how long they will last. Crowns and other types of veneers are much more predictable. Another limitation to these composite veneers, especially when you're just doing a couple of them, which is normally the case, otherwise this takes a really long time, is that you're limited to the shade of the current teeth, meaning you have to match the shade of these teeth with the other teeth, and sometimes that works out and sometimes it's not very good. With veneers or crowns, you can start over with the shade and the shape of the tooth. Also, what makes crowns and veneers better is that all the work is done outside of the mouth, so the person that's making them can put a lot of time into getting the cosmetics right. These chairside composite veneers are limited by the amount of time that you're able to spend doing them during the appointment. So as you can see, they do turn out nice, but in fact, rarely are they the best option. But apart from those limitations, I actually love doing these. It's funny because many other dentists out there that consider themselves cosmetic dentists do a lot of veneers. And while the dentist is responsible for creating an optimal canvas to work on when they do veneers and crowns, the lab technician normally is the one that does the veneers and the crowns, and he's the one that's more responsible for the cosmetic work. With these bondings, however, I am doing all the cosmetic work from start to finish. And so just as an artist, I guess, I'm a little more proud of my cosmetic work when I do all the work myself. As you can see, it really is all my cosmetic artwork per se. Now I'm going through just a series of polishing discs that I use to refine this resin composite bonding. I will put up a before and after now so you can see how much we were able to change his smile so that he was finale ready for the cameras. Now you can definitely nitpick this. There were small things I would change definitely if I had more time, but I only had a small window of time to complete these, especially when adding an extra tooth that wasn't originally scheduled. But that being said, I was happy with it, and he was ecstatic and had a nice smile for the cameras at the finale. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.